right, ready to go. So sex hormones, that's what we're talking about today. And I was just telling everybody that was on earlier, hormones by definition is just a signaling molecule, something that tells the body or tells the cells to do something. And so we're referring to the gonadal hormones this morning, which would involve testosterone, estrogen, progesterone, and the thyroid hormones, and how they all sort of crosstalk to each other. And it's not really a very simple topic. It's actually quite complex. Just so you know, to pretense this, and most of you know me and you know the practice that we have here at Salt Health, but it's a functional medicine based practice. So that means that we look for root cause. We start asking the question why, where, and how. We may know that someone is in menopause. We may know someone has hypothyroidism, but we want to know why they have that and what's kind of triggering it, what maybe is keeping it going, and how can we sort of right the system. So we do look at things. If you look at the tree analogy, we look at things down lower in the roots and in the trunk. The top of the tree is thought to be symbolic of the diagnosis that people might have and the symptoms. So that's where, you go get your diagnosis of menopause or you go get your diagnosis of hypothyroidism. Well, the question becomes, why does this person have that? And what can we do to help mitigate the symptoms and or correct the problem? So that's the functional medicine lens that we, use here at Salt Health. So today we're talking about both male and female hormones, sex hormones. And there's clearly a difference between the two. As we all know, we can tell just by observing the population, there is a difference. This is kind of a funny video or slide, but I think there's maybe some truth to it. Actually, I have my chocolate smoothie right here, as a matter of fact. All right, it's very complex and very complicated. When people come to me and they say, or come to Jacob and I and they say, hey, Dr. Herbst, I think my hormones are messed up. Well, that's a pretty loaded statement, actually. It's never very clear cut. So I think a lot of times in the world of medicine, as you all know, if you're not doing functional medicine, you're giving, a prescription for a symptom. So if you came to me and said, I have hot flashes, and I was strictly thinking medical minded, then I say, oh, okay, well, maybe I should give you some estrogen, or maybe I could give you an antidepressant because sometimes that helps lower the stress levels, and then therefore you stop hot flashing as much. And maybe if I'm really out of the box, I might say to you, cut back on your caffeine because that can cause some problems with hot flashes. So that's your typical standard approach. If a male comes in and says, hey, Dr. Herbst, I think I have problems in the bedroom, one of my first reactions might be, as a typical medicine doctor, would be say, here's some Viagra or here's some Cialis. So if you're thinking functional medicine minded and you came in and you told me that you have hot flashes and hormone problems and your family doesn't like you very much and you're really not motivated and things aren't working well in the bedroom, my first question is going to be, so how stressed out are you? What's going on with your thyroid? What's your genetic makeup look like? How's your gut? And you're going to want to punch me in the nose because really all you want is something for your hot flashes. But if you look at the steroidogenic pathway, you can see that it's pretty complicated. And this is just the communication from the cholesterol molecule made in the liver down to the ovaries or down to the testicles. And there's actually a bigger bunch of more feedback loops that include the pituitary, hypothalamus, and the thyroid. So there's an adrenal gland. So there's a lot of crosstalk between this whole endocrine system that plays into why you're having hot flashes or why you can't have a good erection. So when you come and ask me for hormones, it's going to be a lot longer conversation and a lot of testing and sometimes some trial and error. But I think it's something that we can easily take care of. You just want to do it safely. And by looking at this, I just want to point out one of the things that people don't understand is when you talk about estrogen, there are actually 3 dominant estrogen molecules. And then those 3 dominant estrogen molecules have some metabolites that are smaller versions of that one. So there's some that are very fatty, they're fat loving, those 2-hydroxys and the 16-alpha hydroxy and the 4-hydroxy estrogen that you see on the bottom of the screen, the 2, 16, and 4 with the OH, those are very fat soluble, fat loving. You have to have proper genetics and you have to have proper dietary support and proper methylation support to convert that fatty estrogen into the water soluble type of estrogen so the body can pee and poop and sweat it out, the parts it doesn't need or doesn't want. People don't understand that if I just give you estrogen and you don't metabolize it correctly, then you're more prone to having a lot of those inflammatory fat loving estrogens, which really, if you think about it, makes sense. That means those people are at a higher risk for things like breast cancer or uterine cancer, endometrial cancer, because they're fat loving, they get sucked back up into the fat. So to be safe, you want to know how that person is metabolizing their hormones. What are they doing with it? Do they leave it in the fatty form, or do they metabolize it into the water soluble form so that we can eliminate them like properly? So that's something that I always think of. If you're asking me about testosterone, a lot of men will say, I want testosterone, I think I need it, I'm low, which is probably true, because you're going to find out it starts dropping pretty early. But the question I pose is, do you have a male pattern baldness history? Do you have prostate issues in the family? Because if you're taking your testosterone that I might give you and help you replace, and you're converting it more into DHT, then you have a higher risk of those things. If you convert a lot of it into estradiol, then you end up with man boobies, and you don't like me very much. So really, you got to get to know the patient, do some lab work, and really understand how their body works before you start writing that script. There's a lot of things that play in, as you heard me just talk about, but diet is a really big player. Sleep plays a role. Toxin levels and toxicity exposures play a huge role. Stress, interestingly enough, good stress is good to a point, but high amounts of stress for a long period of time really shut that whole HPA endocrine axis down, and it slows things down. I always tell my patients, if you're really stressed out for a long period of time, your body knows that supposedly you're running from the tiger or running from the bear and you're in danger. So it's going to shut down the hormones and slow things down. You don't have periods. You don't want to be making babies when you're running from a bear. So stress really plays a role at lowering our hormone levels and putting us in sometimes into early menopause or having lighter periods or messed up periods. So stress is a big one. Inflammation in the body, especially of systemic inflammation, that's another stressor on the body. So we think of stress by, you know, my boss yelled at me, or I stubbed my toe, or the traffic was terrible on Airport Avenue Boulevard. But that's one type of stress. Internally, the body has stress as well, especially if you're highly inflamed. So working on inflammation before you balance hormones is a really good idea. If your gut's really messed up and really yucky and there's not a good balance, a good flora, then you don't have what's called beta-glucuronidase. And we're going to talk about that, which is an enzyme that's produced by bacteria that help metabolize estrogens. And so we really want to have good healthy gut presentation. Foods play a huge role, and I'll show you a little bit of a slide here in just a minute on some foods that help metabolize estrogen especially. So those are all the things that can play into this problem that we might all present with to our doctors. But as you can see, I'm just proving the point that it's not so straightforward. This is kind of a funny, but it says I have PMS, ADD, and OCD. I want to kill you, but I can't focus on that right now. I have to go wash my hands. So some of us might understand or relate to this picture, but it's kind of driving the point home. It's a very complex situation. Some women will present with all sorts of problems in menopause, as well do men. And this is just a neat little slide that I borrowed from the internet. Both of us, male and female, will go through some kind of drop in hormones, very significant drop in hormones around the age of 50. But interestingly enough, testosterone gradually starts really decreasing for men in their 30s. For women, it actually testosterone starts decreasing in their 20s, but they'll have a rapid drop in estrogen in around age 40. That's an interesting little fun fact. Percent of testosterone as you age in men drops quite a bit. This is a little bit dated, but I thought it proved the point. By about the age of 60, you've dropped about 70% of your testosterone for males. So men do go through menopause. People think that's a joke and think it's funny, but actually it's very true. Their bone density decreases, their muscle mass goes down. They start getting a little bit more fat around the belly. It used to be where, you know, you hear stories where I could eat anything and it didn't gain weight. And now I'm just gaining weight. I'm getting man boobies, and I'm really lacking in my motivation. So erectile dysfunction, interestingly enough, for low testosterone comes later in the game. All of these other things happen first. So when someone comes in and they're telling me they have trouble in the bedroom from a sexual function standpoint, I think to myself, they're really low in testosterone. They've gone way past the I've gained belly fat. I kind of lost my go get 'em attitude. I'm kind of a little bit blue. Maybe I'm a little more anxious than I ever used to be. yeah, they've already gone past all that. Now they're down into to really, really low levels. So for men, low testosterone is not straightforward. It's not just a matter of, oh, I have low T. Some people have what's called primary hypogonadism, meaning that the testicles just aren't doing what they're supposed to be doing. And then most people will fall into the secondary hypogonadism title or diagnosis. And that means that something else is disrupting that communication between the pituitary and hypothalamus. The whole endocrine feedback system is a little bit off and wonky. And that can be influenced by, like we were talking about, stress, diet, obesity, toxicity, medication, etc. So that's a secondary type of low T. So a lot of times we work at fixing those things first, and then we balance hormones. So we talked about that already. Women also, as I was saying, lose testosterone, start losing it about in their 20s. And interestingly enough, a fun fact, women make more testosterone over their lifetime than men make ever. So this is something I wish more people had told me and that I had known about when I was younger, especially when I was sick. I finally decided to actually take a pellet or get a testosterone pellet myself last year. And it's the best thing I've ever done for myself. And I wish I had done it many years ago when I wasn't well, because the anti-inflammatory component of testosterone is amazing. And so if you have joint pain, autoimmune stuff, feeling really stiff in the tendons, it makes a huge difference. So a lot of other perks, but that one for me was pretty profound. Estrogen receptors are found in the brain, the bone, and the breast, both in men and women. Very important hormone. And the more genetic testing and genomic testing that I am doing and learning, I'm seeing more of those receptors that are really important, especially in the prevention of Alzheimer's. So it's an interesting note because I don't think a lot of people realize that we have those everywhere. Estrogen is really important for men too. They actually have a established reference range that is normal for men. Some people think that, oh, they don't need any estrogen, it's not important, but it is, especially for brain and bone preservation. Men definitely need some estrogen as well. There is a testosterone receptors in the brain. This is actually fairly new. When I say new, in the last 15 or so years, 20 years, they've been really studying these hormone receptors in the brain because they're looking at, of course, prevention and reversal of Alzheimer's. It's becoming a hot topic. And so it's interesting to know that, yes, it also plays a role in the bones and in the brain as well. So testosterone and estrogen, very important. And as we lose it as we age, that's when we can start noticing that, quote, brain fog, forgetfulness. It plays a role into that. So if you're highly stressed, or this is you trying to be super mom, great at work, we start getting overwhelmed, we start getting super stressed, our cortisol starts rising. And that plays into what I call, or what is called, the feedback loop. It's actually a negative feedback loop, meaning that when you have high levels of something, it goes back up and crosstalks to the hypothalamus in the brain or the pituitary, and it says, hey, we got plenty of this business down here, or she's in fight or flight mode, or he's doing too much. I don't need you to be making any more of this stuff down here. So it feeds back and tells them to make more or make less. And so that's what they mean by a feedback loop. And so they're all tied together, the hypothalamus, pituitary, the thyroid, and then the gonads, and adrenals fall in the middle there. And adrenals are responsible for the production of that stuff over there on the side where it says cortisol in the purple. So the more cortisol someone has, that interferes with production of your sex hormones because you're in fight or flight. So things kind of slow down. Body also borrows progesterone when you're in fight or flight. And this really affects women a lot because progesterone is really important for keeping our menstrual cycle regular and normal. So the less amount of progesterone you have, the heavier and clottier and longer your periods will be. And so progesterone is really important because the body borrows progesterone and its precursors, pregnenolone, to help with high levels of cortisol regulation. So the more stressed we are, the more we have messed up hormone cycles. Same with the men. They don't have periods, but it definitely plays a role in blocking their testosterone because it's, again, testosterone's anti-inflammatory, so it helps regulate inflammation, helps with the cortisol balance. So you can see the slide over on the left, how The more cortisol you have, the less testosterone you have available. So lowering your stress is really, really important. Deep breathing, gentle walking, exercise, laughing, visiting with family and friends, you know, those are all really important stress relievers. Just pointing out the fact that your hormones will speed up or slow down your genetic or genomic pathways. And so this MAO and COMT pathways are methylation pathways and monoxamine pathway. Those are regulated and downregulated and upregulated by hormones as well. And so a lot of people have these genetic mutations that SULT1A3. They have a lot of these little funny mutations where this enzyme's not working well as it is. And then if you play around with the hormones, then you're going to change the way that pathway works as well. So the genomic part plays a complex role as well. And you can test those and see, you know, where do they have some problems? How can we help upregulate it or downregulate it? What's going to happen if I give them estrogen? What's going to happen to them if I give them testosterone? Again, just pointing out deep breathing and the effects it can have on cortisol as well, and sleep. So if you get good sleep and you do a lot of meditation or deep breathing or some downtime during the day, you can effectively lower cortisol. And they did some studies with women that were trying to get pregnant. Brain injuries can cause low testosterone, low hormone levels, primarily low testosterone. And I worked with a lot of veterans at Cleveland Clinic, and this is actually how I learned about testosterone pellets. They're a bioidentical form of hormones that you put under the skin that are slowly released over time, keeping a nice steady state level. For men, they last about 5.5 to 6 months before they dissolve completely, and then you can replace them. Women, they last 3 to 4 months, depending on how active you are. But the point being, I learned about it because there was a urologist that was doing pellets, and I was taking care of some really very special veterans and that had a lot of brain injuries. Well, when you're doing their history and you hear traumatic brain injury, I was practicing parachute diving and I fell on my head and I had a concussion, you know, that lasted for a week. All of those are signals, car accidents, even just bumping your head really hard on a cabinet. I've had someone do that. That can cause such a drastic pituitary damage or trauma that you get interference with that feedback loop and testosterone can drop. So if you know anybody that had an accident or hit their head or fell on the ice and had a little light concussion or playing football or sports, and then all of a sudden a year, 2 years later, they start getting a lot of ailments or mental health challenges, think testosterone, because it is a huge player. Exercise does help raise testosterone. I know it's the more muscle mass someone has, whether you're male or female, the more testosterone that you will make, which is good. It helps, but it doesn't raise it a whole lot in my experience. Gut health is huge, 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 huge. I borrowed this slide because it was cute, but the bottom line is you can see they talk a lot about gut dysbiosis and excess sugar in the diet and how that increases stress hormones. The gut dysbiosis, because you're feeding the wrong kinds of bugs, that decreases your beta-glucuronidase, which is that enzyme I was talking about that helps convert estrogens into the good estrogens and so that you can excrete them. So a lot of that really plays a role in hormone connection. There's a big hormone connection with the gut. So really important to have a healthy gut. This also is proving a point. I just wanted to reiterate the importance of the microbiome in its relationship to sex hormones. Again, this is talking about the same thing I was just saying there. If you have really good gut bacteria, especially the lactobacillus level, and then there are some specific GI bacteria that help with beta-glucuronidase activity, that's really important with hormone regulation. Genetics plays a huge role. These are some of the more recent literature. This is some of the more recent literature relating to genomics. So those funny little mutations or tweaks in the DNA that Tim's talking about, I think this week, or he's already talked about. In his lecture, he's going to talk about genomic testing, which is find small mutations in a genetic mutation or a variant, which makes an enzyme not work as well as it should. Either it goes too fast or too slow, or it's irregular in its activity. And so what they were studying here is the metabolism of estrogen with those 4 genetic mutations, and how much more prone those patients were to developing adenomyosis, which is some problems in the muscle tissue of the uterus. Toxins play a huge role. If you cannot metabolize them because you have genetic mutations that impair your detoxification pathways, you're at a higher risk for storing toxins in the fat. Several of those toxins are what they call estrogen and or hormone disruptors, plastics, pesticides, fertilizers, all of that business. So if you're exposed to a lot of that through your lifetime and you've stored it in the fat, you have already set yourself up for some hormone disruption. So part of getting somebody well is replacing the hormones, yes, but also cleaning up the system so that they have better reception and receiving the hormones, and the signaling, it works better and is more regulated. This is just an couple interesting articles that I put on here having to do with toxicity exposure and then deposition in fat. So they were looking at, for instance, PCB, which is plastics in the newborn infants, and they were measuring that and looking at their levels right as they were born using their cord blood. And they found that they all had very, very high levels of POPs, which is pollutants from the environment. That was in 2013. Let's see. They also did another one where they looked at contaminants. If you had that CYP1A1 mutation, meaning that you had a harder time clearing out estrogens and plastics and petroleum-based chemicals. Anyway, they looked at that also in some whales, although I know you're not a whale, but they looked at in the fat tissue that in the water, where they knew that the whales were living in water that was high in this oil and gas by this oil and gas company. So we're just looking at fat concentrations in those whales, and they also looked at the ones and compared them to the normal population compared to the population that had a genetic mutation, where it makes it really hard for them to clear out those pollutants and also metabolize hormones that are related to that same pathway. Anyway, that's what that was about in 2008. Sorry, totally messed that one up. So we're looking at genetics, environments, and toxins on this page. So if you get to this point, you probably ought to come and see the doctor, talk to your physician, talk to somebody about hormones and hormone replacement. It can really disrupt relationships. I think that we, unfortunately, especially women, have just accepted the fact that when you go through menopause, everything dries up, it hurts, I don't want it, I have no mood, no desire, my skin gets crunchy, I gain some belly weight, nothing, sensation goes away. Intercourse is not something that's on your mind when things aren't working correctly. And so if it gets to this point, please reach out to your physician, come see us at SALT, because I tell you what, it's a game changer. This pellet placement, I can speak personally, but vaginal dryness, joint pain, tendon pain gone. My mood is much, much more steady, chill, and now I understand why my ex-husband could just roll with it. So he had a good amount of testosterone. It was awesome. So anyway, I think that please don't get to this point. Environmental Working Group is a website that I've mentioned before on my lectures, and this is just a reminder that they can help you with things like looking at your water base, what good foods should you be eating, what are the clean 15 foods, what are the dirty dozen, those are the ones you should be avoiding. So if you go to ewg.org, it's a nonprofit, wonderful website that's constantly being updated, so we can kind of minimize the amount of toxins that we're bringing in. Nutrition plays a huge role. So if we eat a lot of colorful phytonutrients, phytodense foods, it helps us with metabolism, it helps us with natural hormone production, it helps us level out our cholesterol, and so forth. These are some of the key nutrients for methylation. So if you have MTHFR mutation, which is a really common genomic mutation where it impairs your ability to methylate in the folate and B12 pathway, these are great vegetables and nutrients for you to be consuming. Also can help with the detoxification pathways for plastics, petroleum chemicals, phenols and so forth. Remember, stress plays a humongous role. So make sure that we, take a deep breath. We get outside in nature, take your shoes off, walk barefoot, get grounded, enjoy your family, laugh a lot, and slow down. Oh, I wanted to see, I'm going to go back. I know this is me wrapping it up, but give me 1 second. I want to go back and show you something here because I think it's really important. One of the things I hear a lot is I never had high cholesterol until now, and that's usually around the menopause, perimenopausal time. So if you look at the top of this steroidogenic pathway, you see the cholesterol molecule up there in the corner. So the only way, or the way that the body makes hormones, is by using cholesterol. So if our hormones level drop, if they drop as you're going through perimenopause or menopause, and your testosterone's dropping, and your estrogen's dropping as the ovaries and the testes are slowly getting smaller and not producing as much, the feedback to the liver is, hey, I need some more hormones. So it asks for more cholesterol. So suddenly when you're drawing blood at the age of 45, your doctor says, oh, you have high cholesterol, here's a statin. I just want you to realize and understand that it's not a statin deficiency. Now, you may have a genetic predisposition to higher cholesterol. It may be a lot harder. You may have already tried to change diet. But if your hormone levels are dropping, your first thought should be, maybe I could balance hormones and then my cholesterol will go down. If you balance hormones and your cholesterol goes down a little but not a lot, then that's the time for the medication. But just remember that there is a reason that the body is saying, hey, dump out more cholesterol. Now, if it's because you're eating Twinkies and Sonic and high fatty foods all the time, then that's on you. But my point is, if you change a diet, it's still high. You're around that age where hormones are dropping. You might want to think about balancing hormones before you go straight to medication. So back to the end so we can wrap it up for questions. Bottom line is deep breathing, exercise, walking, eating clean, enjoying life, and realizing that just because we're aging doesn't mean that we need to just say, it's all done and over with. There is help out there for a little bit better quality of life as we get more mature. Any questions? I'm going to minimize that so I can see everybody. Anybody have questions? And if you have questions, you can type it in the chat box. You can also raise your hand or unmute yourself, whatever floats your boat. I don't hear anything, but it may be because of me. Jess, any questions for anybody? Nope. Yes. If you start pellet therapy, do you take them for life? So the answer is yes, if you want to. So the point is, you start taking hormones in general, you're going to, if you're taking them, in my mind, you're taking them because the ovaries and the testes are not functioning properly. Occasionally, I will use them as short term to kind of spur things on, or to help someone get out of their illness state. If they're really, really ill, they may need a little boost to help get them better. I used to use it in ICU to get people out of the ICU, actually. So sometimes you use it short term, but if you want the benefit, you'll use it as long as you want it. And once you stop it, your body just goes back to your normal baseline, which wherever that was. For me, it was really low. It's going to go back to low eventually. That was a good question. Very good question. There are some people that ask about pellets. The reason for pellet, I learned, I really like bioidentical hormones. I don't like synthetic hormones. I think they play havoc in the body. You have much higher risk for bad outcomes. That's where most of your literature comes from, is from the synthetic stuff. So the synthetic progesterone was the big World Health Organization study what they did, and they said hormones are bad for women. It was actually the progestin in the hormones, which is very synthetic, very inflammatory. So I'm really big into bioidentical. If I'm going to use them, I want them to be as similar to our body's own hormones as possible. And the pellet is bioidentical, and it's a steady state. Topicals are also bioidentical. They don't work as well. About 50% of the population don't absorb, and it also depends on where you put it. So one day I may put it over here and I have good absorption, good circulation there, but then the next day I put it here, not as good blood flow to that area, maybe not as much fat in that area. my levels go down. And so it just really, there's a lot of variables when it comes to topical. Not that it doesn't work. I actually encourage people to try it first, because then you know you have options. But I have found that the pellet definitely is, it exceeds the expectations compared to the topical. Any other questions?